So next, I would like to introduce James Norris, who is a digital fellow here at Harlington Hospice. James is the founder of the Digital Legacy Association and the amazing advanced care planning website, MyWishes. James has a national profile, and we are very lucky to work with him at Harlington Hospice. Welcome, James.
Good morning, everyone. Digital legacy, what it is and why it matters. So as Carol said, for the last probably about 15 years, I've utilised and explored how society and healthcare professionals can use technology to improve aspects of end-of-life planning, end-of-life care and bereavement support. And I do this through a number of different means, whether it's raising the profile of planning for death in the context of technology, utilising existing technologies that exist, so perhaps Facebook or Twitter, etc. And then when technologies don't exist, try to explore to build something that might be able to help. So we're going to start with the theory. Over the last 15, 20 years, the internet has changed many things. It's changed the way in which we communicate, it's changed the way in which we do business, and we're kind of living in this phase where we are migrating from this physical world to the digital world. 20 years or so ago, all of our currency was physical, all of our shopping was physical, our music resided on CDs and vinyl and cassettes, again physical, and the games that we played was in the physical space. And a lot of these pieces, these assets, are migrating into the digital space and becoming digital assets, and our behaviours, many of which are not changing, are taking a different format and again migrating into the digital world. Every year or so we run a survey called the Digital Death Survey, and it explores how technology is changing and how technology is being utilised in the context of end of life. And the chart here just gives a quick indication as to the ways in which technology is now being used for end of life planning, end of life coordination, and bereavement. Only 9% of those surveyed said that they hadn't used technology or social media during somebody's illness or impending death, and that statistic might also include people who haven't perhaps lost somebody close to them during this time. Just to give you a few data sets from this chart, the responses to I have used technology to include communicating with the person who is dying, share links and information that would educate others about the dying person's illness or condition, raise money to help for the person's care, provide emotional support to the dying person's family and their friends, coordinate practical assistance, for example, to organise care and provide the delivery of meals. So there's a whole array of ways in which people are using technology in the context of end of life. And despite what we might read in the media, the vast majority of experiences around social media and digital media at the end of somebody's life is a positive one. So again, when we asked what was the impact of using digital and social media following a friend or family member's death, 58% found it a positive experience, 20% said it was both positive and negative, and then 21% said it was neither positive or negative, and just 1% of those surveyed said that it was a negative experience. The first term we're going to look at today is digital legacy, and our digital legacy is ultimately what remains of us digitally after we die. And our digital footprint, so the interactions that we have during the course of our lives, can inform our digital legacy, but it's not the only component to it. If I was to have died yesterday and there was a online obituary published about me, or if somebody posted something on Facebook about me, that would form my digital legacy. It's not owned by us, it's not owned by anyone, just like our legacy isn't owned by anyone, but we can have influence into our digital legacy. When we asked this year, do you know what a digital legacy is? 23% of society now appears to be very familiar. 42% said very familiar. So this term now is becoming a lot more widely known and understood. And our digital legacy is important for a number of people for a number of reasons. So on the left-hand side, you can see a screenshot of Facebook, and it's my housemate from university's Facebook profile. Ben died of adult sudden death syndrome 10 years ago, and his Facebook account means more to me than where his ashes are scattered. I won't go to visit, ever his ashes. I won't go to a religious place of worship to remember him, but I will go to his Facebook account because there's messages that's shared between us, there's photos that he's uploaded, and if I'd gone to university perhaps 30 years, 40 years ago, we would have had printed photos, we might have exchanged physical letters, etc., but we didn't. It was all digital, so his Facebook account means a lot to me. After Ben's death, a good friend of ours, a mutual friend from ours from university, Andrew, created a fantasy football league for Ben. And Ben played fantasy football before he died, and it's a way in which we have been able to continue bonds with Ben. It's a private league just for his friends, and every year we pay money to be in this private league, and it's a non-morbid, contextually relevant way for us to remember Ben as the person he was on a platform that he used. It's been used to raise a lot of money as well for the Adult Sudden Death Syndrome charity that's been associated with him. And again, this is very important to me, and this means more to me than where Ben's ashes are scattered. So, influencing your legacy and your digital legacy. So the things that you do during the course of your life, as mentioned, will inform your legacy and be your legacy. And your digital legacy and your physical legacy are intertwined. Then they're not mutually exclusive of one another. You can influence your legacy and your digital legacy by ensuring that certain stories that you want to be told are told. And that can be true both online and offline. Carrying out altruistic tasks, whether it's planning for your end of life, advanced care planning, will writing, funeral planning, etc., can have a positive impact on your legacy. There's no immediate reward for making plans. You're doing it for others. When it comes to your digital legacy, you can look and you can assess what's online to have an influence within it. So if you've uploaded some photos to Facebook or to previous social networks, MySpace, etc., you can delete them to make sure that they are not used to remember you by. You might want to, in today's world where we're taking photos every single day on our phone, curate our favorite photos. Just like we used to curate photos in a photo album, we can curate them digitally. We can print photos locally, again, giving those photos longevity. With the amount of content that we're now creating, it's even more important that people know those stories. And just like perhaps 20 years ago, 30 years ago, we might have written around a photo in a photo album, on the back of a photo, what's happening, what the context of that photo is. We can do that within the digital space as well. But ultimately, just like palliative care is everyone's business, digital legacy is everyone's business. Everybody should take control and ownership of their physical lives, and they should also take control and ownership of their digital lives as well. The second term we're going to look at is digital assets, and our digital assets are or can be purchased, stored, created, and available online. And our digital assets might be a photo that we've taken on our phone, it might be an ebook that we've downloaded, a movie, an online game, a cryptocurrency, etc., etc. And our digital assets are spread across an array of different devices, our laptops, phones, hard drives, old hard drives, etc. And then they're also in cloud services such as social networks, online account storage, etc., etc. So they're segmented across an array of different places. Before the digital revolution came along and the internet became part and parcel of day-to-day life, when somebody died, all of their assets largely was in one place, their home. And when it came to passing them on to a next of kin or making sure that they're not lost, it was, although a last will and testament took precedence over the assets of monetary value, it was quite easy to distribute things after somebody's died. But this is becoming increasingly difficult, with each platform having its own terms of service, each platform having a password-protected entity in some way, shape, or form, and also many of them now requiring biometrics or two-factor authentication for security purposes, which makes things even more difficult. When we asked, again, society, how familiar are you with the following term, digital assets? About 50% of people are either somewhat or very familiar with this term. But just to recap, our physical assets are increasingly migrating and becoming digital assets. And again, despite what the media tells you, there is no such thing as a digital afterlife, a digital eternity, a digital forever. There's only digital longevity. Just like a physical photo can have its digital longevity expanded by having it printed multiple times, telling the story so that people want to keep that photo, putting it behind a piece of glass, etc., for protection. This is still true with digital photos and digital assets. If you've got a favorite photo of you and your family, sharing that, printing it out, etc., can enhance the longevity. But when we reflect and look back on previous platforms such as MySpace, where people uploaded photos, which are now largely gone, and many other sites, even 2 weeks ago, Facebook deleted all of the live-streamed videos that had been uploaded to the platform that were older than 30 days. So, the organizations, the platforms that we upload our content to are not the guardians of our digital legacy. We are the guardians of our digital legacy. 10 years ago, I launched the Digital Legacy Association, and the Digital Legacy Association raises awareness, educates, evokes relevant conversations, which hopefully lead to improved decisions, and there's better outcomes in areas relating to our digital life. And we've got a tutorial hub for the general public, a range of different tutorials, again, where platforms already exist and we recontextualize them in the context of end-of-life planning. So one example is on Facebook. Facebook allow you to download all of your photos and all of your content and ultimately back it up. But in the second tutorial here, how to download your Facebook data and pass it on to your next of kin, we recontextualize and highlight how that might happen in the context of end of life. So if you're supporting somebody who's got a young child and they've got photos and videos on Facebook, their young child might not have access to Facebook at that time, so they might want to download and pass it on to their child, and again, curate their photos, perhaps delete messages that would be there, etc. When it comes to making plans for your wider digital life and digital legacy, we've created a very, very simple social media will. It's an Excel document that's downloaded locally, and it's been referenced and promoted by Martin Lewis, a money-saving expert. And ultimately, all you're doing is stating what your online accounts are, how you want them to be managed, if you've made plans for each, just so your next of kin, again, knows which accounts you use and what your wishes are for each. Now, if your wishes for certain platforms go against their terms of service, then they might not always be able to take place. So if, for example, I purchased a song on Apple, and let's say, for example, I don't know, Coldplay Clocks on Apple, I'm not able to download that locally because their terms of service and their platform doesn't allow you to do that. However, if I purchase the same song from Amazon, their terms of service does allow you to download it locally, and you've got that locally on your device. So if in my digital and social media will, I said I want my music library to be transferred to Joe Blogs, it might go against Apple's terms of service and might not be able to take place. But by having a digital and social media will, at least your wishes are documented and you can pass that on to each provider should it be required. There's lots of work to do in this space. So again, according to our research, only 5% of people have documented their online wishes within a social media will or a digital will. And we do try to, again, highlight the value and the reasoning for society to make plans for their digital lives by collaborating with professionals. As mentioned at the start, digital legacy conversations and digital legacy planning is very important, and we argue that it should form a holistic approach to advanced care planning. It might simply be perhaps you're doing a ward round and somebody's using their mobile phone, and you ask them, what they're doing, and they say, I'm on Facebook or I'm doing such and such, and you might just ask, have you thought about, is it important to you? Are your photos important to you? Have you thought about passing on the password to your mobile phone so that somebody can have access? Or have you, again, curated your photos or used one of the different methods that allow you to pass on administrative access to a loved one? So for some people, a digital legacy conversation might be as simple as just seeding that little piece of information and letting it open like a Pandora's box and leaving them to it to think about and plan and make plans for their online lives. But then in other circumstances, it might be more complex. We've got a range of different, so everything on the Digital Legacy Association website is free to use and download. I'll make sure that there's a box of leaflets at the end of the day that people can take away and use as they see fit. But ultimately, the leaflets and the posters, again, just provide a little bit of an overview as to why this is important and how they can start making plans. We published a conversations framework, digital assets and digital legacy conversations framework, that complements the work of advanced care planning conversations. And within it as well, it includes information about age discrimination. So the fastest growing demographic on Facebook is the over 75s. When it comes to thinking about our digital assets and digital legacy, it's not just for the younger generation. It's something that I'm kind of told quite a lot at different health and social care events. It's like, this is really important. I could see how it would be important for the next generation. No, it's important for everybody because the vast majority of the people in the UK use the internet, have got online accounts, and as I say, it's up to them to decide which services they make plans for and which ones they don't. There's free-to-use leaflets and copy on the website as well, which you can download and use. And then we also provide policy and advice for different organisations and not-for-profits. Our Digital Legacy Conference, which is also another way in which we engage with health and social care professionals within this space, took place here virtually during COVID, and those videos are online, and also quite often with EAPC, most recently with PHPCI in Bern. Thanks a lot.
Thank you, James. Like Joe, I think we could listen to James talking all day too, so both very interesting. If you'd both like to come up now, and we have just a few minutes before coffee for any questions that anybody might have.
Joe, it's just I was thinking. I always think I'm like you. I'm not there. I'm not for. I'm not against. But we would definitely have to have separate facilities. You couldn't give the care that we're given in the hospice alongside people that don't want to live anymore.
Thank you, Donna. That has been a strong argument for many years now, that if this is what society wants, if that is what our parliamentarians vote for, representing their constituents, then we will have a Dignitas type of facility in this country. However, the current proposal of this private members' bill is absolutely, although the devil is of course going to be in the detail, that is not in the proposal. It doesn't mean to say that that won't happen if private companies then do think this is a service that we will offer elsewhere. But actually, if this becomes law, it will be up to the state to provide it. And from everything that I have certainly read, and certainly particularly Hospice UK, there is an assumption that this will become provided by the NHS through either community primary care, hospitals, or possibly those hospices that choose to opt in. Okay, that was certainly the last thing that I have read. But again, Donna, I can't tell you definitely because we don't know. But thank you, and that is one of the very large concerns here around, well, within our teams, we will have some people who are responsive and receptive to this and others who are not. So again, that's why key to this is preparation and education and listening to people like your concerns.
Yeah, hi there. It's a comment, really. I appreciate the Canadian documentation about assisted dying, but I'd just like to put forward the idea that we're not actually comparing like for like. Uh-huh. So I worked out in Canada for 2 years as a rural GP.
Yep.
And our health system is completely different to the health system and the services you get in Canada. So I think a lot of the decisions that we might make as individuals in the UK should be based on what we have to offer. Because really, having worked rurally, I've seen so much pathology, seen people that have not been able to access care, and that would have an effect on them wanting to have assisted dying and not being a burden. So I think we should compare like for like and not always. I think we're so privileged to have the NHS and the services that we have for palliative care. And I just want to put that forward for us to have that in mind when we read what other countries are doing.
Yeah, and thank you. That is a very helpful comment, and I'm always very loath, you're quite right, to try and draw too many comparisons amongst, again, Oregon and so on. Thank you for that. Helpful.
I've got a question for you, James. I shouldn't have a question because I work with you all the time, but hearing you talk about a digital legacy, I think it now needs to be embedded in our holistic assessment when we meet somebody for the first time, whatever their age. I mean, we often end up struggling with somebody who's becoming confused and hasn't shared their mobile phone password or code with their next of kin, which means you don't know who to invite to their funeral. And I remember trying to persuade a really confused person who just could not remember the 5th and 6th number of their code, and we lost contact with their iPhone.
Yeah, no, I totally agree. It's, our digital lives is, so important for so many people. You could argue as well that digital is now a dimension of well-being because we spend so much of our lives online. So, making plans and including that as part of the assessment and conversation process at the start of the patient's journey would be very, very I'm sure, valuable for the patient and their loved ones.
Another question coming up. It's a quickie, I promise. This is for you, James.
not that I know anything about platforms, but what emerging platforms do you see coming up in the future which may change the direction of what you're doing in the digital legacy now? Is there anything new that we should be horizon gazing for?
So I think organisations that hold and host our photos and memories are starting to get better at providing ways in which content can be extracted. Something that in the last 2 years has become very, very prominent is artificial intelligence. And now AI with, let's say for example, I wanted to upload a photo of my dad and there could be some kind of animation for him. That would distort my memory of him, but the Victorians would have said a similar thing about photos. But his digital legacy will now be changed if I were to do that. So I think the way in which we interact with our loved ones through AI will be the main thing over the next few years. It won't be anything that we include in MyWishes or anything specifically that I do. Our research again found that the majority of people do not want to be reanimated or reincarnated using artificial intelligence. And so I think that will really be the thing, the way in which we can, perhaps with augmented reality glasses and through touch sensors, you know, it will become a lot more immersive, I feel, in the next few years.
Okay. Oh, we've got one more question. One last question from Paula.
Hi, James. I was just listening on the radio this morning and they were talking about how we store data. And data centres are using a lot of water. And we're also facing a climate crisis with water and how we ethically use water. And it got me thinking about how much we store in our data. And I was thinking about my Gmail that I really need to get back over and delete loads of stuff. But then that leads me thinking about is there something about helping patients or people with their wishes of what they save, but what they don't save as well? Because the idea of all this data and these data centers that have been built to store and store and store and cloud and cloud and cloud will inevitably have an impact on the environment. And I know the government have to look at how they're going to save water in the future. So I suppose it's not an answer, but I'm just thinking there's probably two sides to what we save and what we don't save as well. And how do we encourage people to think about ethically, the ethics of data? Yeah.
Yeah, I think in terms of the storage costs, and as you say, the resources is huge. And the computing power now, especially of AI as well, is kind of increasing that dramatically. Platforms who hold our photos and videos quite often, after a year of inactivity, will just delete the account. So quite often, you know, if a loved one passes on access to their Google Photos or their Dropbox account, etc., and they don't access it for a year, quite often there'll be an email that's sent that will say, if you don't log in within X amount of time, we're going to delete the account. So there are certain ways in which the environmental damage is removed by these automatic processes. But at the same time, that can lead to secondary loss when people don't log in and they think, oh, my loved one's photos of all of us is here. I've downloaded a few of them locally, but I know that archive's there. So yeah, so there's kind of pros and cons. But I think ultimately it's kind of planning in advance, curating your favorite photos, your favorite digital memories, and making sure that your loved ones know what they are, whether you've emailed them, printed them out, whatever's best for you and your loved ones. And then when content is removed, whether it's by a third party or whether it's by yourself as part of your kind of end-of-life planning process, you think, I'm going to delete these things, then at least it's sorted and it's addressed, and yeah, your wishes are followed, whatever they are.
Okay, so a big thank you to Joe and James. Thank you very much.